one of the areas that is really taking center stage right now in those conversations are the changes around the federally facilitated marketplace and the state-based exchanges that are using the federal platform. And just for context, you'll remember that in 2018, CMS said that network adequacy determinations for QHP plans would return to state jurisdiction across the country. And some states that had the infrastructure required to continue full network adequacy determinations, they could do so. If a state did not have those resources, they had an opportunity to accept, in lieu of full accreditation, an accreditation from NCQA or URAC. Or if a plan was not accredited by one of those organizations, they could present an access plan to the state, and that would satisfy network adequacy requirements. Fast forward a couple of years, and in 2020, CMS said, we're going to be retaking network adequacy determination for the federally facilitated marketplace states and also those state-based exchanges that are using the federal platform. And we're going to talk a little bit about what we believe that means today. It's a significant change. For those of you that were looking for information about the exchange, you probably have seen that in September of 2021, just a couple of months ago, we did get a glimpse into what CMS is thinking about the forthcoming network adequacy requirements. And there were a couple of important pieces of information in that first glimpse into the rule. The first was that CMS does anticipate using Medicare Advantage-based requirements. It won't be a Medicare Advantage lookalike, it's not a mirror, but using the Medicare Advantage as the foundation as they look at network adequacy requirements for plan year 2023, which will be the first year that the federal network adequacy that's common across all of those states will take effect. They also have been talking quite a bit, not just in the notice of benefit and payment parameters, but also in other public-facing documentation and reports about a focus on health equity. That's probably not news to anyone on this call today, but understanding that CMS is thinking about how can, as a federal agency, network adequacy standards and rules begin to close those gaps is a big part of the conversation. So for example, and you can see this on the far right-hand box of this slide, picture a requirement that said in your provider directory for those plans offered on the exchange in a federally facilitated marketplace or a state-based exchange that's using the federal platform, the information that's going to be required may include race and ethnicity of the providers in the directory, the languages spoken by those providers. It might require accessibility for very specific patient populations, as well as hours of operations. And you can think of other related kinds of information that would begin to be required potentially in plan year 24. So as we think about the scope of this change, moving from a state-based decision about how to ensure network adequacy to a federally rolled out solution starting for plan year 23, we can look at the following map on the next slide. And what you'll see is that there are 30 federally facilitated marketplace states expected in plan year 2022. And this information, by the way, comes from the Kaiser Family Foundation, a great resource for your planning. There's another 18 state-based marketplaces. Those are the blue states that we have on the map here. And then the gray states are the 3 state-based marketplaces that are currently using the federal platform. So the network adequacy requirements, again, moving from a certification for accreditation from NCQA or URAC to a full-blown network adequacy review will take place in those yellow states and those gray states for a total of 33 for plan year 2023. Now, the question I get frequently is, what about the blue states? What about those 18 state-based marketplaces? And the answer there is that some of those states have indicated that if they have the resources to conduct network adequacy reviews, and they'd be willing to look at, once the final requirements are public, what is the marketplace requirement for network adequacy in those 33 other markets, and possibly adopt them for the purpose of consistency. But that remains to be seen. Those 18 state-based marketplaces will still have the opportunity, because they are not using the federal marketplace platform, to create their own network adequacy rules. So we'll be watching those as well. In terms of a timeline, this is how we believe the changes will roll out. Starting a couple of boxes in, after we see the finalization of the network adequacy requirements and rules for plan year 2023, which will be issued between now and the first part of 2022. In mid-April, as you can see in that top red box, technical guidance, or the letter to issuers that you were familiar with, will be sent to carriers, and that will articulate the technical requirements for network adequacy. Then, later that same month, the certification application process opens up. So that's when plans will say that they would like to be reviewed for the purpose of offering a marketplace plan in a specific state. And then in the fall, the green box on the top, around early October, again, approximate dates here, but to see the flow of things, CMS will send its certification notices to carriers who have met the network adequacy and overall network requirements in a particular state. Again, 33 of those states having now the same rules under a federal policy driven through CSIO, which is part of CMS. Then in November, open enrollment begins, and in January, plan year 23, the first year of the new network adequacy requirements being in force, that plan will begin to operate. Now, on the far right-hand box, that red box on the bottom, I'd like to bring your attention there for just a moment, because that is when we believe that if you look at all of the publicly available information, you think about the conversations that we're all having with our regulators, that is when we believe that we'll see the first new network adequacy requirements introduced. So we know that in plan year 23, the boxes we've talked about up until now, we know that that will be very similar to Medicare Advantage. We also know that CSIO has been very clear in their public-facing materials about the need to close health equity gaps, and that there will be standards related to closing those gaps potentially in future plan years, and that would start in plan year 2024. So something to think about as you're preparing for plan year 23 and those network adequacy standards being in force across 33 states with a common network adequacy process, 18 states to pay attention to understand what are those specific state requirements. And that's something we are watching and happy to help with whatever we learn there. And then also be thinking about what are the potential new network adequacy standards that we could see in plan year 2024, which would be the following cycle to what you're seeing on the screen.